Namaste.
Hi Santosh.
Yes.
Hello Santosh.
Hello.
Namaste sir. Is it audible to everyone?
Yeah, it's audible.
Yeah. Audible Santosh?
Santosh is not seen.
Yeah. Santosh back camera. Yeah. Now is visible. So audible to everyone?
Yes, yes.
Yeah.
Yeah. So namaste ma'am and sir and hello Santosh. So this is episode 4 and we welcome all the audience. So myself Sangeeta Singh from Banaras as I am in my hometown and Santosh from Hyderabad. We both welcome our guest speaker Dr. Rajkumar sir and Dr. Ramya Krishnan ma'am as I have given brief introduction of both of them in previous episodes. So Dr. Rajkumar sir, pioneer of SBBA, Associate Professor and HOD of Roganidan and Vikruti Vigyana Department, Government of Puducherry Mahi, and Dr. Ramya Krishnan ma'am, pioneer of SBBA, Associate Professor and HOD of Draveguna Department, Government of Puducherry Mahi. So this is episode 4. In order to proceed that, we will just brief the episode 3. What we have seen in episode 3, just like little bit we will brief that. So Santosh, please, like we have seen the three aspects actually in episode 3, like Yukti, Dravya Guna and Rasha Shastra. So we will elaborate, I will just briefly elaborate that. So I'll request Santosh to start from Yukti, briefing Yukti.
नमस्ते शरण मैम। तो युक्ति, हमने जैसे पिछले एपिसोड में युक्ति के बारे में जाना था, तो मैम ने बोला था युक्ति इज नॉट एन इंडिविजुअल परसेप्शन, जो कि आजकल कॉलेजों में पढ़ाया जाता है कि युक्ति अपने हिसाब से होती है, लेकिन ऐसा नहीं होती। दोषाद्यपेक्षा भेषजस्य समीचीन कल्पना इज युक्ति। सो डिपेंडिंग ऑन द स्टेट एंड स्टेज ऑफ कॉज, state and stage of vitiation of dosha, it may be agantu or sthanika dosha. So how you are choosing Bheshaja, that is medicine, is yukti. So it is like the multiple factors contributing to one effect. So we have to analyze all the factors which are contributing to the disease aspect. In Ayurveda, the target is reversal of all cause mechanisms and finally achieve health by applying yukti. So in short term, yukti is a process of systemic and scientific analysis of appraisal of cause mechanism of dosha dushti and reaching the conclusive diagnosis by the complex factors. But it is not possible by natural intelligence. इसलिए शास्त्र सहित तर्क is important. So शास्त्र सहित तर्क is called yukti, means reasoning led by inbuilt scientific standards given in the Ayurveda. So again, yukti कैसे प्राप्त करेंगे? So yukti ज्ञाना is led by प्रत्यक्ष, अनुमाना and mainly आप्तोपदेशा. And the final conclusive diagnosis and treatment should be based on these three. So पिछले एपिसोड में राजकुमार सर ने ये भी बोला था कि युक्ति योजना भेषजस्य देह दोष दोषाद्यपेक्षयो. So it is an application which is not blind application or which is not based on experience. So if you have to assess dosha, deha and vyadhi, then you have to assess bhesaja for the disease. Or this all can be done by yukti. Thank you. Over to Sangeeta.
सो द्रव्य गुण में हमने ये देखा था कि इज मॉर्फोलॉजी एक्टिव प्रिंसिपल इज इम्पोर्टेंट और नॉट. तो ये बताते हुए मैम ने बताया था कि नाम रूप गुण की इम्पोर्टेंस जो है वी हैव टू आइडेंटिफाई विथ नाम रूप गुण. एंड इसी को आगे बताते हुए सर ने बताया था कि ऑल्सो वी शुड नो द मोड ऑफ एप्लीकेशन. इवन इफ वी आर नोइंग नाम रूप गुण, we have to know the mode of application, because we need to know ki and like what is the we have to develop the like which we need to develop is like rog pariksha, rogi pariksha, bheshaj pariksha. We have to consider all of this in order to apply the yukti and skills. So along with that nama rupa guna, we have to also develop the mode of application is also we need to develop, because जो नाम रूपा गुण है उसमें जो है कि like everything which we apply with guna siddhanta. So one of and guna is one of the padartha, and gun which is dependent on dravya samvai samvar, and we cannot take active principle, because active principle out, because it is in samvai samvar. So it will be like utter waste to learn active principles. So all we need have to focus is on ayurveda perspective. So रस पंचक का इम्पोर्टेंस बताते हुए मैम ने बताया था कि रस पंचक इज द क्रूशियल फार्मेकोडायनेमिक सबस्ट्रेटम ऑफ द्रव्य गुण एंड आयुर्वेदा. And yukti and art is the two things which we have to focus, and dravya has to be taught under three main classification, like doshagna karma, rogagna karma, and bheshajagna karma. So and also guna is a functional entity. So in ayurveda everything is decided inside the patient. What is rasa is going to do, vipaka is going to do, prabhava is going to do, virya is going to do in health status or in disease status, after digestion, before digestion. So like we have to consider everything inside the patient. So guna will not act without karma. So like rasa pradhana ahara, virya pradhana aushad. So like suppose for example if we are taking madhura rasa, so it will not act in the same way. Depending on different karma it will act. So shastra and shastra should be the theory and practicals of the ayurveda. Also like we have a primitive curriculum of details and non-details drug. So instead of that Ramya ma'am have suggested that we have to make a syllabus like in a shrotas wise, and under shrotas, like for example pranva shrotas, we have to be which bheshaj karma comes under pranva shrotas and which drugs comes under that. Likewise we have to make our syllabus, and whatever the rampant diseases are there nowadays, dravyas which we use, we have to focus on that. And also in last dravya sangraha vidhi, ma'am has told that it is not a mandatory topic, and the problem is like as sir told that the syllabus is made by DG faculty. So instead of it has not not from a clinical objectivity. So if we will make the syllabus from clinical objectivity, then only we will learn to like what is the important things which will make us bishop. We will learn. So in also Rasha Shastra, uski importance ma'am ne bataya tha ki it is an important discipline, but we shouldn't focus on Shodhan and Maran only. We have to be like same as in Dravya Guna. We have to focus like Doshagna Karma, Rogagna Karma, and Bheshagna Karma has to be explored in clinical OPDs and in theory also. And no subject is what we say non-clinical in Ayurveda. Every subject is clinical. So that is the briefing of episode 3. So संतोष, like जैसा हमारा एपिसोड का नाम है, मेन टाइटल है हमारा एपिसोड का हाउ टू लर्न टू अंडरस्टैंड आयुर्वेदा, है ना. सो इसकी इम्पोर्टेंस बताते हुए हमारे आचार्यों ने श्लोक्स दिए हैं. इन श्लोक फॉर्म्स इसकी इम्पोर्टेंस हमारे आचार्यों ने बताई है कि लाइक फॉर व्हाट इज द पर्पस ऑफ आयुर्वेदा टीचिंग, ये बताते हुए आचार्य वाग्भट ने अष्टांग संग्रह में बताया है कि शिष्यो अध्ययो गतो यावद अंतम तंत्र अर्थ कर्माणम, मतलब कि अध्यापना टीचिंग इज टू बी डन टिल स्टूडेंट अटेन थ्योरेटिकल नॉलेज एज वेल एज प्रैक्टिकल नॉलेज, तब तक जो है कि हमें अध्यापना टीचिंग हैज टू बी डन, है ना।
हाँ, तो अध्यापन के बाद भी लाइक एक और श्लोका बोला है वाग्भट जी ने कि एस्तु केवल शास्त्रज्ञ कर्म स्वपरिनिक्षिता सा मुह्य आतुरम प्राप्य प्राप्य वीरुरिवाहनम। मतलब जो फिजिशियन के पास नॉलेज होती है, शास्त्र की नॉलेज होती है, लेकिन उसकी प्रैक्टिकल नॉलेज नहीं होती कि उसको कैसे अप्लाई करना है, वो हमेशा जब भी पेशेंट के पास जाता है, लाइक उसके पास नॉलेज होती है कि इस पेशेंट में क्या करना चाहिए, कि एक ट्रीटमेंट इस तरह होना चाहिए, लेकिन वो नहीं कर पाता, वो डर जाता है, जैसे लाइक कोवार्ड डर जाते हैं व्हेन ही अप्रोचेस द पेशेंट।
राइट। और नॉट ओनली दैट कि शास्त्र की इम्पोर्टेंस केवल आचार्यों ने बताई है, इवन शास्त्र की भी इम्पोर्टेंस बताते हुए आचार्यों ने कहा है कि यह पुनः कुरुते कर्म दृष्टेय शास्त्र विवर्जिता सस्तु ग्राहम आपनोति वदम चर्चति राजतः, मतलब कि केवल जो जिसको केवल बहुत सारे कर्म आते हैं या शास्त्र आता है, लेकिन शास्त्र का बेसिस नहीं है, एक साइंटिफिक बेसिक नहीं है साइंस का, तो दैट पीपल ऑल्सो डिजर्व टू बी किल्ड बाई किंग, ऐसा बोला गया है कि सो लाइक हेयर वी कैन की मोड ऑफ किंग से हम समझ सकते हैं कि जो इंडियन मेडिसिन का बोर्ड है, वी कैन कि हाँ दे हैड टू बी अबैंडन्ड फ्रॉम आवर सिस्टम। सो
हाँ, बिल्कुल सही बोला आपने। और लाइक एक और मेरा लाइक वन ऑफ द फेवरेट कोट है वाग्भट से। वाग्भट जी ने बोला था कि हेतो लिंगो प्रशमने रोगा नाम पुनर्भवे ज्ञानम चतुर्विधम यस्य स राजा हो भिषक उत्तम। लाइक एक परफेक्ट भिषक, उत्तम भिषक कैसा होना चाहिए एज पर लाइक राजा, लाइक सब आजकल बोर्ड ऑफ इंडियन मेडिसिन हो गया, सीसीआईएम हो गया, उसके हिसाब से जो जो फिजिशियन में 4 एस्पेक्ट्स होने चाहिए, उसको 4 चीजें मालूम रहनी चाहिए। वो है हेतु, ईटियोपैथोजेनेसिस, लिंगा, सिम्टम्स और लक्षण बोलते हैं हम, प्रशमना लाइक हाउ टू क्यूर द डिसीज, उसका शमना करना है, शोधन करना है, और रोगा नाम पुनर्भव, जो कि आज के जनरेशन में बहुत इंपॉर्टेंट है कि रियकरेंस ऑफ डिसीज को कैसे रोके कि फिर से ना आए। तो जो जिस फिजिशियन को ये 4 चीजों की नॉलेज होती है उसको हम उत्तम भिषक बोल सकते हैं।
सो ऑल्सो जो है कि आचार्यों ने कहा है कि ज्ञानशेन ना ही ज्ञानम कृत्सेन गे प्रवर्ते बुभुत सेत भिषक तस्माद तत्वम तंत्र अनुशीलनात्। What nowadays is happening is analytical reductionism, but Ayurveda is not like that. We cannot do the analytical reductionism, like because जब भी हम पेशेंट को एक्सप्लोर करते हैं, we have to know the entire principle or entire thing about that. So if we will do the analytical reductionism, we will just harm the patient by like benefit and risk, and we will not cure that patient.
तो जैसे आप हार्म की बात कर रही थी, तो लाइक एक और श्लोक याद आ रहा है मुझे। लाइक वाग्भट जी बोलते हैं एस चिन्नता आमा अज्ञान दक्ष पक्वमुपेक्षते शपच चीव विज्ञेयो ता विनिश्चित कारणे। मतलब द फिजिशियन जिसको आमा और पक्वा स्टेज की नॉलेज नहीं होती, लाइक हु डज छेदना इन आमा स्टेज बाय इग्नोरेंस और हु अवॉइड छेदना इन पक्वा स्टेज, लाइक ऐसे दोनों फिजिशियंस ऑलमोस्ट क्रिमिनल के समान होते हैं। लाइक दे आर लाइक क्वैक्स इन द मॉडर्न एरा में। सो ऐसे टाइप को फिजिशियंस को हमेशा अवॉइड करना चाहिए, अबंडन करना चाहिए।
सो इन ऑर्डर टू कंक्लूड दैट हमारा जो साइंस बेस्ड मेडिसिन है, इसकी इंपॉर्टेंस बताते हुए आचार्यों ने कहा है कि प्रत्यक्ष तो च यद दृष्टम शास्त्र दृष्टम च यद भवेत संसाद तत् उभयम यो ज्ञायम विवर्धनम, कि like practical knowledge means shastra knowledge, pratyaksh knowledge, and shastra drishtam means shastra knowledge, इनके कॉम्बिनेशन से जो है कि साइंस बेस्ड मेडिसिन जो है कि विच विल गिव अ ट्रू विजडम ऑफ आयुर्वेदा एज इट इज. So it is not like medicine based science, it is science based medicine which is told by acharyas. So which is the crucial necessity for everybody who is in Ayurveda. We have to study science based medicine because acharyas has clearly mentioning by shlokas and not medicine based science. So this was the just a small introduction. So, ma'am, there was one question from Rasha Shastra. There is one shloka, Alpa Matra Yogitvat. So, what is your point in that?
Alpamatrobe yogitvat. In Rasa Shastra, there is a shloka like Alpamatram asandigdham ayujer aprasangadaha क्षिप्रम आरोग्य दायित्वात् औषधेभ्यो अधिको रसः. So it is like alpamatra ubyoga is enough. Aruchi is not there. The problem of aruchi is not there. So क्षिप्रम आरोग्य, fast action is there, and therefore among the bheshajas rasa is best. Like that one shloka is there. But the thing is that in Ayurveda also, I mean in non-rasa shastra part of Ayurveda also, similar kind of reference you will find. अल्पस्यापि महार्थत्वं प्रभूतस्य अल्पकर्मदां कुर्यात् संयोग विश्लेषे कालसंस्कारे युक्तिभिः. अल्पस्यापि महार्थत्वं, even when you administer a medicine in alpamatra also, it can accomplish very big objective if you are administering it in the correct samyak prayogam. If you are using it in an optimized manner, if you are administering it as science-based medicine instead of medicine-based unknown action. If you are administering as science-based medicine, Jnana Purva Karma, JPK, Jnana Purva Karma, then the effects are very fast. So it is not like Rasa Shastra itself is required for producing Ashugari effects and Arogya effect also. And there is no question of Aruji and all when fragmented dosages. Like in SBBA, we are giving granules of medication. Granules of classical Ayurveda medicine, not Rasa medicines, we can administer, and we find in our practice, all of us, that it is giving fast and accurate results. So it is applicable in all the various disciplines of Ayurveda, not only in the sessions.
I would like to add that
Yes, sir. Yes, sir.
medicine action is by virya. So we need not give so much medicine to act on the Vyadhi virya. So Vyadhi will be having a Roga virya will be there. So when we are making the environment totally different with Pathya, with Ahara and Aushadha, with Ahara and medicated water, when we are changing the environment, medicine is required only in very small dose. It will directly act on that target. So when virya is correct, when pathya is correct, very less dose of medicine is only required. When in that environment, in that hostile environment to the disease, when we are applying medicine in right dose, in right time, according to the state and stage of the patient, it will be very much less quantity only needed. As in fevers, we are using only less than 1/10 of a tablet to cure a disease, cure a fever, cure an infective fever. To cure an inflammation, we are using only half a tablet. So if you check the cost of that medicine, it will be coming around 2 to 3 rupees. So nowadays, the practice is writing so many medicines without the exact pathya. So that will be causing more harm than benefits. So it's not going to cure the patient, and it will be producing harm also. So the most important thing is medicine is acting with virya. So when virya is acting, you need not give so much medicine. So that is possible with herbal medicines also.
Yes, sir. So like एक और क्वेश्चन था सर, जिसको लाइक रसशास्त्र के प्रोफेसर्स बहुत हाईलाइट करते हैं उस रसशास्त्र को बहुत बड़ा दिखाने के लिए, जैसे ना रोगानाम ना दुष्यानाम ना च पुंस परीक्षणम ना देशस्य ना कालस्य कार्य रस चिकित्सते. लाइक इस बारे में आपके व्यूज क्या हैं सर?
Rashastra is you cannot say that it is not based on Ayurvedic principles, Padartha Vijnana and other things. You cannot say like that. Whenever a patient is there, you have to go for Sukshmanihi dosha bheshja desha kala sharira ahara satmya sattva prakriti vayasam avasthantarani. Yani Anuchindya Manani, Vimala Vipula Butterapi Buddhi Makuli Kuriyu. So before administering a medicine, you have to assess all these things. Even Vimala Vipula Buddhi may also get confused. So Acharyas are very much specific and specific that we have to go through all this analysis and estimate which treatment principle is the perfect and how to apply it perfectly. All these are explained in a very systematic manner. This sloka, it looks some prakshipta sloka like it is not normally present in that. And I think it can be used as a vyadhi viparita without considering dosha. So vyadhi viparita is directly against roga. So in Taruna Jara, if it is if it is to be applied, it can be just Pachana Aushadha. So just to make the armor status change. So you need not be considering all these things. But then also, if it is to be scientific, you have to go through all these things. All these sukshma samikshesham dosha uchata nirupani. Dushyam desham balam kalam analam prakritim vaya sattvam satmyam tata aharam avasthasya prathakvitha. Sukshma samikshesham dosha uchata nirupani. So we have to analyze. That is what is scientific. Otherwise, it becomes medicine-based practice, isn't it? So
right.
Maybe in Agantu Jwara, it might be mentioned, or it can be of Taruna Jwara for Pachana. Other than that, it doesn't have much significance. That sloka doesn't fit to that context because Acharyas have mentioned all the Nidanas, then the treatment principle of each and every Jwara. Then afterwards, Acharya cannot say that you need not check for Dushya Desha and other things. And so that sloka is artificially fitted there. I think it is not normally present in there. Yeah.
Then I would like to add one or two things more that actually in that sloga it is considered there is no need, it is told that there is no need to consider the host. But at the same time, it is very clearly mentioned in Nava Jwara, certain medicines are mentioned, means this Nava status is applicable to Jwara. And how do you assess whether Jwara is Nava, Pachimana or Pakwa? In the patient only you can assess. You cannot take Nava status outside the patient and assess and decide Nava. So the avasthas can be decided only in the patient, and avasthas of doshas are being decided. So it is not that avastha is something different. So Nava, if it is mentioned, certain medicines are mentioned in Nava, means it's very clear that it is done in the patient. So patient assessment is very important. And second thing is that all these medicines, whatever we consider, they are mentioned in, Maharasas context. They are, Doshakna karmas are mentioned. If in Rasa Shastra, you don't need to consider doshas, then why Doshakna karmas are mentioned? For each rasas, Maharasas and Uparasas. If my memory is correct, in Uparasas also, but I am very sure in Maharasas, Doshakna karmas are mentioned clearly in all the references. So if they are not required, then why do? Such an analysis has happened before. That's why basic research results are elaborated in the shlokas. So they have conducted,
I think,
for sure, clinical research. Yeah.
in the next sloka itself, Acharyas might have explained that this rasa is good for Vatik Jwara or Paitik Jwara. So that becomes invalid immediately after that. So Vatik Jwara, if you have to find out, then that dosha, desha, everything has to be checked. No.
Yes, sir.
So it becomes insignificant. Yeah.
Sir, there is one question from audience specifically to you. Sir, is it possible to learn biological perspective of infective cellular changes in cells in variable kinds of infection in Ayurveda perspective? Had SBBA developed any algorithm to understand this and apply?
Biological changes.
Yeah. is it possible to learn biological perspective of infective cellular changes in cell in variable kinds of infection in Ayurveda perspective?
Infection we have already deciphered. Whatever infection, whatever the causative agent, we have deciphered the what will be happening inside the body. So first we need to know how to understand modern biology in Ayurvedic perspective. That is the first thing. Then we need to know how the physiology works, modern physiology, how we can interpret. And then comes the pathophysiology. So you cannot directly explain what are the cellular changes that are happening in an infective status. So we need to assess from the modern perspective itself. So we can, as all these are dravyas. Dravyas are which are perceptible, which are made up of Pancha Mahabhutas. Pancha Mahabhutas are Behirindriya Grahya Vishesha Gunavatvam. So which can be percepted with our 5 special senses are Bhutas. So all Bhutas, so all structures which are in the Sharira are made up of Pancha Mahabhutas. So we can identify each and every structure on the basis of this Pancha Mahabhuta concept. Even a cell. Cell we can understand with Pancha Mahabhuta concept. And all the cells, tissues, organs, various systems we can understand with Pancha Mahabhuta in modern biology, what is being explained. And functional aspects. There are fluid mechanisms, fluid systems. There are neurohumoral mechanisms. So all these we need to understand from Ayurvedic perspective. Anyway, all these are perceptible. All these could be perceptualized. So we need to understand Samano, Annam, Grihnadi, Pachati, Vivechayati, Tharedi, Munjadi. So all these are functions of Samana Vayu. So Samana is responsible for Annam, Grihnadi. So receptive activities by Samana Vayu. Pachati, transformation is done by Samana Vayu. Vivechayati, so separation is done. Unchati, absorption is done. And excretion is done. So what is needed is taken, absorbed, and what is not needed is expelled. So Samana, what activities we can understand with modern biology. But we cannot exactly correlate. So how homeostasis is maintained, how normal metabolism happens, how in infective status, what all changes are developing, that we can understand with Ayurvedic perspective of modern biology and physiology. So pathophysiology we can understand only after making out all these changes. So with SBEBA, science-based, evidence-based Ayurveda, we have deciphered what all cellular changes are happening in infective status, how inflammation develops, how immune system is reaching there, and how immune system is going to destroy that, and whatever be the antigen, how we can modulate the immune activity. Everything is deciphered, and this is I have to teach from the very beginning. I cannot explain that here. It is deciphered in SBEB, and when we are applying the principles according to that, we are immediately getting the results also. Within 24 hours, we are getting the result.
Yeah. Yes, sir. Which you have elaborately explained in Unveiling the Truth in Ayurveda.
Yeah.
So now we will start the Roga Nidana subject. So, sir, in order to that, what is the significance of Roga Nidana in Ayurveda? So my question is, what is the difference between modern diagnosis and Ayurveda diagnosis? Because when we see in our college level, we have it has been taught in a comparative manner, and in practical also it has been directly correlated that if some hemiplegia paralysis patient is there, it has been directly correlated to pakshaghata. If sciatica patient is there, it is directly correlated to gridasi. So like that, it has been in comparatively way it has been taught. So what is the difference between modern diagnosis and Ayurveda diagnosis?
Yeah. Roga Nidana, we will start from. Roga Nidana is Nishchitya Diyade Vyathiraneni. So, Vyathi, it's we are diagnosing. It's not lab diagnosis, it is clinical diagnosis. So, we are reaching a conclusion is Roga Nidana. Also, Nidana means say the Kartabhya Dagu Yogotpadago Hetur Nidana. So, it is not just the development of a certain set of symptoms with which we are diagnosing a disease. Certain causes, intrinsic cause as well as extrinsic cause. It will be initiating a set of changes inside the body, which is termed as mechanism. So that cause mechanism, sa iti kartavyadago, rogotpadago hedu. So that cause, external cause will be initiating an intrinsic cause. That intrinsic cause will be producing a set of changes inside the body in specific systems, which will result in development of certain signs and symptoms, which is the disease. So we are identifying a roga with its cause, external cause, internal cause, and the mechanism. It is not just when you are seeing radiating pain, you are diagnosing it as grithrasi or something else. So we are identifying with cause, external cause, internal cause, and the mechanism. So cause, mechanism, effect is established with diagnosis. So Ayurvedic diagnosis is not just naming a disease. Rogam, Nidana, Pragrupa, Lakshana, Upashaya, Samprapti. So with all these factors, we are identifying a Roga. So that is Roga Nidana or clinical diagnosis in Ayurveda. But in modern, only the immediate causes are found out. And all the external causes are either told as risk factors or associated factors. So cigarette smoking is a cause for atherosclerosis. It is not a cause, it is a risk factor. So all these are not established. That cause, mechanism, effects are not established. And the immediate mechanism which is happening, that plaque ruptures and immediately blood clots and results in infarction or myocardial infarction happens like that. So only that mechanism, immediate mechanism which is happening, like rupture of plaque and platelet accumulation, resulting in decreased blood flow to the heart, only that is considered. So the diagnosis will be infarction. But in our diagnosis, it should start from the external cause, internal cause, and the mechanism. So grithrasi is not a disease in Ayurveda, because grithrasi will not manifest as such. It will be starting with a cause, external cause, and an intrinsic cause will be there, and then a mechanism happens, and then finally the manifestation of that disease develops. So always it should be associated with doshaja roga. Dosha will be always there along with roga. So it can be vadic grithrasi. If it is by some other cause, it can be by avarana, it can be by samsarga. So kapha vadaja grithrasi, kaphavrta vadaja grithrasi. It can be sama vadaja grithrasi, kaphavrta sama vadaja grithrasi. So many possibilities are there. So grithrasi diagnosis is nonsense in Ayurveda. I have seen a diagnosis as Vishwaji. Whenever shoulder pain is there, it will be diagnosed as Apabahuga. That is wrong. It can be by inflammatory cause, it can be by many other causes. So, and it's not a joint disease also. Whenever shoulder pain comes, it will be diagnosed as Apabahuga. It is Amsamula Sthido Vayu Sira Sankochya Tatraga. It is Vayu is affecting Siras of shoulder joint or Amsamula. So it is Siragada Vada only. It is not Sandhigada Vada. But shoulder joint pain is diagnosed as in all Ayurveda colleges. It is not, I am not to someone. That is the general trend. They are not exactly finding out what is happening. So it is Vada Vyadhi, so Apabahuga means it is Vada, and they will start applying oil. If it is associated with fever or if it is associated with inflammation, nothing is checked because Apabahuga disease is Vadi. So without dosha, if it is diagnosed, is 100% wrong. That's what I told. Understanding with modern biology, physiology, pathophysiology, that will help to confirm the Shastrarthas. If you are able to understand it in the proper way, like you cannot correlate something with something. Like Samana is this one. Samana plus Annam Grunadi Pachati Vivecheti Thareti Buncheti. So all these things are done. So it can be correlated to this thing. It cannot be told like that. It has got so many other functions also. Dosha Mala Shukrartava Ambuha Sroto Vichari. It maintains homeostasis of Dosha Vaha Srotas, Ambu Vaha Srotas, Shukra Artha Vaha Srotas, Mala Vaha Srotas. So this same thing cannot be, if you correlate that Samana Vayu is peristaltic movements. It is not, because it maintains homeostasis of Ambu Vaha Srotas. It maintains homeostasis of Dosha Vaha Srotas. Shukra Artha Vaha Srotas, homeostasis is maintained. So this is something else. But Ayurvedic approach is so many functions are brought under one Vayu, and with same treatment that can be corrected. And the same dysfunction, same Samana dysfunction can cause problems in all these systems. So based on that, correlation is based on that. In Ayurvedic science, it is explained. We have to understand modern physiology based on these things. So insulin irreceptivity. We can understand that Samana is doing Annam Grinnadi. So receptor activity is done by Samana. So insulin irreceptivity is due to Samana dysfunction. So as we have explored all these things in SBEPA, we are able to understand. So everything which is explained in modern biology, physiology, pathophysiology, if you are able to understand, then we can easily find out. Biology is just explanation of science, life. So science of life is biology. But we are learning nature of life, nature of living beings, along with its environment, in its unique status. So Ayushyani, Anayushyani, Dravya Guna Karmani, Vededi Iti Ayurveda. So we are identifying with its external factors, internal factors, what all mechanisms will be producing. So that is the main difference. So if we understand with modern biology, physiology and pathophysiology also, we can decipher the Samprapti. Our Samprapti should be along with external cause, internal cause and the mechanism. So Gritrasi is wrong. Vataja Gritrasi is correct. Sama Vataja Gritrasi can be correct. Or Kapavrata Vataja Gritrasi is correct. Paksha Khada is wrong. Kadi Shula is wrong. Everything should be based on external cause, internal cause, and the mechanism and the final thing. So, Roga diagnosis doesn't mean that just giving a name. Right? Yeah. Dr. Ramya.
Ma'am, to add something?
So actually the problem is that what I understand is in Roga Nidana it is very clearly mentioned in Charaka that Roga Madho Pariksheda Tado Anandaram Beshadam Tada Karma Pishak Pashat Jnana Purvam Samajare. So Roga Pariksha and Rogi Pariksha both are equally important in Roga Nidana. But what is happening today is Rogi Pariksha, that Desha Tattvadaha, simply writing, that is also not done properly. Desha Tattva Pariksha, when I see the record, most of the records, they have just many colleges simply writing everything as such without any deeper understanding. Desha Tattva Pariksha is done, and more than that, Roga Pariksha is significantly lacking. A Roga is to be examined by Nidana Panchaka. Every roga in yogi is to be examined by Nidana Panchaka, Nidana Purva Rupa Rupa Upashya Samprapti. And that is the main thing which is missing in current Roga Nidana, curriculum as well as training. And also it is written very clearly, Vriddhisthana Kshayavastam Roganam Abhilakshaye Susukshmam Abhicha Pratnyo Dehagni Balachedasam. Then what is told? Vyadhya Avastha Visheshanhi Nyatva Vichakshanaha. Then Tasyam Avasthayam Chadushraya Prabhadyade. Nowadays there is no Nidana Pariksha, Purva Yuba, Samprapti. As sir told now, there is no Avastha, Sama Pachimana Pakwa. There is no identification of Aganda Dosha. There is no what you call ego hedur anegasya tadhegasya ega evahi. Vyadher egasya chalego bahunam bhagavo vicha. One Nidana can cause several diseases. Several Nidanas can cause one disease. Many Nidanas can cause multiple diseases. So such kind of things are not taught. Nidana Arthagara Rogas are mentioned. One disease becoming cause of another. Jara Sandhabad Rekta Pitta. So it has to be clinically demonstrated what is Nidana Arthagara Roga. If a patient comes like that, the students must know what is Nidana Arthagara Roga and also what is Vyadhi Sangara. Nowadays it is very common. Multiple diseases in the same patient. Evam Kritshrataman Rinam Drishyande Vyadhi Sangara and Prayoga Abari Suddhatvat. Prayoga Abari Suddhatvat Tadacha Anyonya Sambhava. So it can happen. Evam Kritshrataman Rinam Drishyande Vyadhi Sangara. Most of the times Vyadhi Sangara, multiple diseases can happen in the same time, in the same patient. How? Prayoga Abari Suddhatva. It is by irrational prayoga, irrational application of diagnostic principle and irrational application of treatment principle. As sir told now, Ababahuga, everything considering as Samas Nayagadavada or Samas Iragadavada, whatever it be, it will be considered in a very loose and irrational way of diagnosis is being done. So it can cause Vyadhi Sangara. Even mismanagement of one disease can cause many other diseases. That point is missing. Then next is in the chapter Roganika Vimana of Charaka Vimanasthana, Guru Vyadhi and Lagu Vyadhi, how to consider what is serious and what is less serious. Prognostic standards. Prognostic standards of diseases today, nothing is taught. In my BAMS, nothing is taught regarding prognostic. It is decided by patient's expressions. When more pain, symptomatic, that Lakshana Bela is only considered. But in SPBA, you are taught what all things will be considered, what all factors will determine Roga Bela. It is very well taught in SBBA. But generally, Bela, Rogi Bela means, Lakshana Bela is determining the strength of the disease for many physicians. Whether that again depends on patient's Satto Bala, many other factors. And also the Bala Samprapti, the most important part, Bala Samprapti. It is not educated properly. Neither theory part nor practical part is taught properly. Net Jnana Avayavena, when analytically one part is taught and the other parts are missing, it can cause Vishesha Vijnanam na Ulpadyade, that Samagra Vijnanam, knowledge in totality, because we must be able to estimate the patient on the whole based on several factors. This is not possible. So it is mentioned in Charaga that Vipradipannaastu Khalu Rogatjnane Upakrama Yukti cha Vipradipadyate. Vipradipannaastu Rogatjnane. When Rogatjnana gets mistaken, definitely the Upakrama Yukti part will also go missing. So that all these points. And also, as it is very, very, very crucial that Rogamado Parikshata, that part I mentioned, Yastu Rogam Avijnaya Karmani Arabhade Vishak Abhi Aushada Vidanatnya Tasya Siddhir Yadrchaya. Yastu Rogam Avijnaya Karmani Arabhade Vishak. When a physician initiating karma without understanding the disease, Roga Vijnana not there, directly going to decide karma, Abhi Aushada Vidanatnya Tasya Siddhir Yadrchaya. Even if he is proficient in Bheshaja Tattvas, his Siddhi, whatever results, many people are telling, I got very good results, then what is the problem? I don't know what is happening in the patient. That all will be explained by some faculties. I am not a faculty. I'm a clinician. It's not like that. It is mentioned very clearly, Shastravan karma talparaha. Chigilsa prabhrado dhiman. Shastravan karma talparaha. If you are a physician, you should be having scientific knowledge. And if you are having scientific knowledge, you are fit to be faculty and physician. So it is mandatory for both. So Aushadha Jnana is not alone. And last but not the least, yastu roga visheshatnya sarva bhaishajya kovida desha kala pramanatnya tasya siddhir asamshya. It is very clearly mentioned, Yoga Nidana and Dravya Guna, importance and second year, very clearly mentioned by Acharya. Yes to Roga Visheshatnya, that is Roga Nidana expertise, Roga Visheshatnya. Roga Visheshatnyana is there. Yes to Roga Visheshatnya, Sarva Bhaishajya Kovidaha, one who is proficient in treatment principles, Deshaja karmas, Rogagna karmas, Doshakna karmas, everything. Desha Kala Pramanatnya, one who is having Yukti Jnana, then Tasya Siddhi Rasamshya, he will be able to make intended results. So what is lacking today in Roga Nidana is that Roga Pariksha Tattvas are not taught and trained properly in most of the colleges. Not only most, 99% colleges, it is not taught, and many colleges, it is not clinically demonstrated. We don't know whether it is Nidana Arthagara Roga, or whether it is Upadrava, or whether it is Vyadhi Sangara. Students are not knowing. They are simply diagnosing some name, calling some name, and giving some treatment based on experience of faculties. So everything should change. Record should change, way of teaching should change, and training should also change.
Thank you, ma'am and sir. So एक और क्वेश्चन था ऑडियंस की तरफ से कि like sir, in the present day colleges, during bedside examination in the Roga Nidana classes, why students are asked to examine patient with modern examinatory parameters like auscultation, percussion and all? And even if it is done, why we are not unable to interpret into Ayurvedic science? Like how we should examine patient on bedside in Ayurvedic terminology?
That's what I have been explaining. Once modern diagnosis, everything is done. So modern diagnosis, it will be giving the picture that these things have happened. So if you are getting loose motion, you can easily identify that this is Atisara. So that doesn't make any sense in Ayurveda. So if there is a rise in temperature, you are having Jwara. So that doesn't have any sense. So we are identifying the cause mechanism along with that. For that, first, Roga diagnosis is to be done like this. Nidana, Pragrupa, Lakshana, Upasaya, Samprapti. That is not enough. We have to assess the strength of the patient also. Strength of the patient is done with Dashavitha Pariksha. So that is not taught properly. So everybody thinks that according to Prakriti, medicine is prescribed. It is not like that. Prakriti is just one factor to assess the strength of the patient. Prakriti, Sara, Samhanna, Sattva, Satya, Pramana, Ahara Shakti, Vyayama Shakti, Vayas are to be examined to assess the strength of the patient. It is not to give a medicine based on his Prakriti or Sara or Pramana. So we have to assess the strength of the patient, strength of the Samprapti, strength of the Roga is also assessed, which is not in any other medical science. Yoga we are identifying, we have to identify the strength of the disease, which is equally important like diagnosis of the disease. So we are identifying a Roga with its strength. Hetu Bala, Lakshana Bala, Samprapti Bala, we are identifying strength of the disease, strength of the patient, and also along with diagnosis, we are reaching the prognosis and further Pravrittirayam, Nivartirathava. So what is to be done? This treatment principle is to be applied along with all the disease conditions present in that individual. So it is not like one disease alone is identified. So in diabetic patient, hypothyroidism can be there. In hypothyroid patient, anemia can be there. So we are identifying all these conditions together in that patient. So the basic cause mechanism, what is happening inside that body, we have to find out. Whether it is Upadrava Vyadhi or Nidana Arthagara Vyadhi or Eko Hetur Anekasya, what she told before. Like Mathura Rasa yoga can produce so many diseases. Mathur Rasa can produce Granthi alone. So one Hetu can produce one disease alone. One Hetu can produce so many diseases. Vega Rotaja diseases. So many Vega Rotaja diseases are mentioned. And Vega Rotha can produce one disease like Adattu Abhinivesha. Vegan Praptan Nigrinnataha. So that alone can produce Adattu Abhinivesha. So assessing the patient in such a manner, Guru Madhura Shida Snikta Upyoga Adisaulya can happen. Guru Shidam Adisniktam Adimatram Samasradam, it can produce Rasavaha Srotas also. So Rasavaha Srota Dushti Rogas can be associated with Adisaulya, or Adisaulya alone can manifest, or Rasavaha Srota Dushti alone can manifest. So in the patient we have to assess so many things, and in a systematic manner. And it is not vague things. We have to identify Hetu in specific, whether so many causes are there or multiple or a single cause is only there. Also, Purva Rupa, what all Lakshanas manifested, and Samprapti in 5 different types. Sankhya, Vikalpa, Prathanya, Bala, Kala, Visheshata. So in all ways, we have to assess the patient. Nothing is done. As told before, Pakshakada is diagnosed. Patient is having hemiplegia, it is diagnosed as Pakshakada. What difference it makes in treatment? So you cannot assess anything. So that is being followed like what a Western system has done. We are blindly following this inspection, palpation, percussion, auscultation that you can learn from first year onwards. There is no big thing in doing that. While learning anatomy, you can practice inspection, palpation, percussion, auscultation, whether all the organs are intact or not. Along with physiology also, you can do that. So in examinations, Roganidana examination, what's happening is student will be asked to do abdomen examination. And what is the diagnosis? So he will be telling one modern diagnosis. He is having rheumatoid arthritis. And the diagnosis is Sandhigatavada or Amavada, something like that. So it doesn't make any sense in treatment. In diagnosis is wrong. So this is not the way to diagnose. So modern things we can apply to identify the roga, and all other things like Hetu, we are assessing the Hetu, the nature of intrinsic cause, which dosha, stage of dosha, state of dosha, and what kind of sampraptis, including Roga Bala. Plus, Rogi Bala is also to be assessed with these 9 factors. And finally, we are reaching the conclusion that this patient is having this much strength, this Roga is of this origin in this unique circumstance with these causes, and the patient is having Roga Bala of this strength. And so the prognosis is this. So it cannot be variable. And I'm diagnosing a case, and somebody else in Punjab or Dehradun or Gujarat, everybody should be diagnosing in the same way. Diagnosis cannot change from person to person or from place to place, because this Nidana, Samprapti, Lakshanas are very well explained, clearly explained in our science. So it cannot go wrong. So if one is not able to do like that, it is they haven't learned properly. That's all.
So one thing I felt is that Upashya and Upashya Jnana is not rendered also. So diagnostic principle can be confirmed only by Upashya and Upashya. Instead of that, faculties are teaching medicine experiences. In this disease, in Navajvara, this medicine, Sudarshana Arishta, Amrita Arishta plus Sudarshana Vadi, or many other Kashayas and Arishtas together mixed. Like that prescription is given. They are not assessing whether based on what principle it is chosen and whether Upashya and Upashya. I don't know in how many colleges students are asked to check for Upashya and Upashya in 24 hours, 48 hours, whether it is responding or not. Gudalingam, most of the diseases presenting today in patients, they are suppressed or masked or altered. So it is very important that students should be knowing what they are doing and whether what they are doing is correct or not, or whether their faculties are what they are doing is correct or not. Then only they can trust that body of knowledge. It is not a matter of individual faculty. What the faculties are teaching should be of some standards, based on some rational standards in the science. Otherwise, if our maths teacher has taught 1 plus 2 is equal to 3, another school 1 plus 6 is equal to 3, then everyone is right. How can it be? It is a science. So they should be teaching rational standards, and how you students can verify whether what teachers teach are correct or not, only from the response in the patient, right? So naturally every student will be curious to know what will happen with this prescription. Upashaya and Anupashaya is to be noted by the students. I recommend all the students who are watching, BMS students who are watching this program, to do this. Carefully assess the prescription. Ask your faculties based on what diagnostic principle this disease is diagnosed like this, and based on what this treatment is chosen, and how Upashaya and Anupashaya, you have to monitor the patient. It is your right to monitor the patient. You are not judging your faculty when you are monitoring your patient. It is your right in a teaching OPD or IPD, whatever it is. Do that and get back to your faculties with questions. Only if you start asking questions, they will start thinking. And it is all wrong. It is not that we all are directly born from the heaven without mistakes. We all are just faculties. Don't call us gods or something. Don't call us legends. We are just ordinary teachers. You can ask us questions. Don't respect us too much by not asking anything. Ask us questions. Argue with us. And if you find something against what is given, you ask why it happened like that. What amendment is required in that diagnosis? How you have made this amendment? You ask all these things. Then only these things will be clear. That is my suggestion.
What is mentioned as inspection, palpation, etc. is entirely different from Ayurvedic Darshana Sparshana Prashna. So we have a specific objective. Ityashesha ameya vyati eduktam dosha lakshanam darshanadir avahidaha. So we have to assess dosha lakshanas by inspection, by palpation, by prashna pariksha. We have to assess dosha lakshana. It is not blind inspection or blind palpation, percussion. We have a specific reason. So what is mentioned in science, we have to adopt that. First, we have to learn that and then apply in the patient and find out. Then we are finding out the nidanas, we are finding out all other factors. So modern diagnostic methods are very much limited to the disease only, and we have so many other things to be explored. Starting from external cause, internal cause. In modern system, there is no external cause and internal cause, or relation between external factors and the mechanism of that roga. So such relations are not at all there. And extra, we have to assess the roga bala and rogi bala, and we have to reach the prognosis and other things.
Thank you, sir. And I will like to ask संगीता जी, उनका रोग निदान में सेकेंड ईयर में एक्सपीरियंस कैसा रहा?
So actually, जैसे कि अभी तक you both have told the in depth of रोग निदान कि हमें क्या क्या एनालाइज करना चाहिए. So now I am realizing कि मेरे second year में what I have faced in during रोग निदान subject and classes कि like we used to do the lab practicals of like finding HB and ESR and doing general abdomen examination or body examination or just taking history, that too with according to modern history we used to take. So all this like Shrotas Pariksha, Nidana Pariksha, Dashvid, Ashtvid Pariksha, that was limited to theory itself, or that has never explained in clinically into patient either on OPD level or IPD level. We are just very blank, and till this day I think many after students doing BMS also, they do not know how to, like, how clinically they can analyze the Nidana Panchak or Rog Pariksha, Rogi Pariksha, like that. So that's how my experience was there in second year. And I guess Santosh might have the same experience.
Yeah, same experience था संगीता जी. Like we have दशविधा and अष्टविधा परीक्षा के शीट्स में होती थी, एंड जब उनके बारे में पूछते थे देवर लाइक प्रवरा मध्यमा अवरा, इन तीनों में से कोई एक चूज कर लो, या फिर फिल एवरीथिंग विद मध्यमा. लाइक साइड सेफ्टी ना अवरा है ना प्रवरा है, लाइक ऐसा सेकेंड ईयर गया था मेरा.
Yeah.
So okay sir.
So now, like, we have never now, like, you have given a framework, a structure, like what has to be taught, like in what way. Till now you have all explained that. So like I understand ki you can't explain everything because this is not a teaching class, right?
Yes.
So but I guess now audience will get the clear perspective that it is not limited. If your faculty is also like our faculty, so you should ask this type of question what ma'am and sir has told till now, I guess. So anything you want to add into this?
Lab practicals is not at all needed for Ayurvedic Roga Nidana. Ayurvedic diagnosis doesn't need, we need not learn all these procedures in lab practicals. We just need to know the interpretation. What is what? Like when you are doing CBC, you are getting reduced hemoglobin or reduced RBC. You cannot diagnose with that. Reduced RBC is not Panduroga. So everywhere it is like that. It is diagnosed as Panduroga. Pandu is a entirely different disease. What was that? Pitta Pradhana Kubudayar Edhokter Kopener Mala Thadunam Syacha Shaitilyam Ojasista Gunakshaya Tado Varna Bela Sneha Echa Penya Pyojasu Guna Prajantik Shayam Atyartham. So it is Pitta vritti in Dhadus which causes Ojo Dushti or Ojo Visramsa, and all other things are happening in Pandu. So when somebody is having reduced RBC, they are not having all these Samprapti or all these cause mechanisms are not happening. Hypothyroidism patient, there can be iron deficiency anemia. So, but it is thyroid hormone deficiency. So there is no pitta vritti in Dhadus. Even if RBCs are less, it can be by infections like malarial parasite if you check in peripheral blood smear, or it can be by inflammation if you check CRP. So it can be by inflammation. So reduced RBC or reduced hemoglobin doesn't mean that the patient is Panduroga or patient needs hemoglobin. Sometimes absorption can be impaired. So when absorption is impaired also, hemoglobin will be less. That doesn't mean that he has to be given more hemoglobin or more iron content in his food. Also, hypersegmented neutrophils. So, increased segments in neutrophils is indicative of vitamin B12 deficiency. So, B12 deficiency is not direct B12 deficiency. It can be absorption is impaired in, or folic acid absorption is impaired. So if you give more folic acid also, this hypersegmented neutrophils. So not based on this lab values you are diagnosing. You need to interpret what is what. So ALT, AST increased or liver enzymes are increased. What does that mean? So there is some inflammation in liver. What caused that inflammation? You have to find out the cause. Evam anyanipicha vyadhi, so nidana viparya chikilse. Always the treatment is to be targeted against hetu. So hetu we have to find out first. It is not like the diagnosis of a disease gives everything, or based on some lakshanas you can diagnose a disease. So fat metabolism is impaired. So you cannot reduce, if you reduce cholesterol also, if you reduce fat also, the subject will be having the same status because it developed by a pathophysiology. Certain changes have happened in the physiology and it developed. So if you reduce fat also, the same status will remain. Like that, everything has to be identified with. Inflammation also can produce anemia. Infection also can produce, like malarial parasite residing inside RBCs can also cause anemia. Hemoglobin absorption when it is less, or folic acid absorption when it is less, it can also produce reduced hemoglobin. So this lab values, how to interpret is more important. So in OPDs and IPDs, this should be a separate thing. How we are identifying with lab parameters, not how to do this test, how to identify with Benedict's reagent, or how to identify hemoglobin content, or you are assessing CRP. In type 1 diabetes and type 2 diabetes, insulin, in type 2 diabetes, insulin is not properly absorbed, or that receptivity is not happening. So there, earlier I told, samana dysfunction can cause irreceptivity, right? There it will be hyperinsulinemia. There will be increased insulin, but it is not getting received in tissues. So there will be hyperinsulinemia. In type 1, there is increased destruction of beta cells. So in less production of insulin. So in that, precursor thing, C peptide is checked. Precursor of insulin is checked. So what we need to understand when we do treatment for type 1 diabetes, it can be of autoimmune origin also. So when autoimmunity is removed, insulin production will improve. So we can check insulin itself. So that means that production has started. So what we need to interpret, what we need to identify with, means understand with this is more important. So this lab practicals, if you do so many tests and all these procedures, if you write in the exam, that is not Roga Nidana. Its interpretation is more important, or most important thing is its interpretation. How you are going to interpret. RBCs are normal in number, but hemoglobin is reduced. If hemoglobin is normal, but RBCs are reduced, what does that mean? So such interpretations have to be identified. If neutrophils are there and ESR is reduced, what you need to understand? In steroid administration, eosinophil will be reduced, ESR will be reduced, and neutrophil count can be more. So we need to identify each and how to interpret is most important thing. That is lacking in Roga Nidana subject today, and we are unnecessarily wasting our time in doing all these lab procedures. So
I agree with
there
that.
should be one clinical thing, like in this patient with this status, Roga Pariksha, Rogi Pariksha, everything has to be done. Along with that, which all lab parameters have to be checked, and how to interpret based on that. Only that much is needed. If that is done, all these students coming out of, means after completing second year, they will be thorough with what all things are to be examined and how to interpret these lab values. No, nobody knows how to interpret these lab values. After completing all the procedures also, they don't know where to apply, what to apply, when to apply, how to apply, right? Yeah, that is
Yes, sir.
a
True,
major
sir.
change that has to be brought in this syllabus and
So
learning.
students are not learning to become lab technicians, no. They are to become physicians. Then what is the necessity? What your rights are denied. You have the right to learn what is intended. That is denied. You have to be conscious of what sir is telling always in your mind. When you are sitting in the lab and learning all this, you should understand everything is fine, but what you deserve to be taught is not taught. That is denial of your fundamental right. You deserve to get quality education. That is denied. So you deserve to ask them why not you are given. Okay, that is very important.
Thank you, ma'am and sir. So our next question was on importance of Nidana and Dosha Vasta, like which.
Santosh, Sir, it is already 8:10. Should we continue?
If it's related with this, we will continue that and stop that.
Like we can end with
With this
the last
question, if it
question,
is
sir.
completed, yeah,
We can end with last question, Sangeeta, like how
yeah.
to explore new diseases in Ayurveda.
Oh, yeah,
How
but
to?
you were asking Nidana question, na? Related to that.
Yeah, Nidana, like sir have mentioned many points related to Nidana in the previous questions now. So I think no need to ask about Nidana more.
Okay.
If it is not related to Nidana or the previous subjects, we will wind up.
Yes,
So
sir.
we can
Sir, there
wind
is
up with the last question.
Yeah,
sir,
yeah.
like how we can diagnose the new emerging diseases according to Ayurveda.
Ayurveda, it is very well mentioned how to identify a newly emerging disease. It is not the name that is important. Yoga examination is mentioned in Charaga Vimana. Yoga Mekekam evam prakopanam, evam yonim, evam utthanam, evam atmanam, evam adhishtanam, evam vedanam, evam shabdasparsha ruparasa gantham, evam upadravam, evam vrithisthana kshaya samanvidam, evam udarkam, evam navanam, evam yogam vidya. Tasmin niyam pravritti athava nivritti. So we are naming a disease to understand the samprapti easily. Jwara means we will be getting that samprapti. Kasa, we will be getting that. We will be easily remembering that samprapti. So whatever be the disease, modern or old one, the set of changes we can assess easily with this evam prakopanam, evam yoni. We can identify the external factors also because everything is explained with external factors. How it will be functioning in his body, in that prakriti, in that sara, samhanna, sattva, satmya, how these doshas will be functioning is everything in that dynamic body with cues presented from the environment. How it is functioning is very well explained. So with
Right.
lakshanas, we are able to easily understand what all changes have happened in which all sadhus and which all systems. And we can identify, earlier I told, Ityashesha Amaya Vyati Eduktam Dosha Lakshanam. We are identifying the dosha with its state and stage. We are identifying which dosha has caused this changes, set of changes. And it's already mentioned what all are the causes for these doshas, external causes, and if it is specific stage or state, Avardhavata. So what all are the causes for Avarana? All those are mentioned. So we can, from Anumana Pariksha, we can identify everything. So starting from Vikara Prakriti. Vikara Prakriti is not Prakriti of the individual, it is nature of the disease. Vikriti Prakriti is Vikara Prakriti. Nature of the disease, we are identifying Samuthana Visheshamsha from external and internal cause. So, Kaushik cause with state and states, Adhishtana Andarani, in which rotas it is happening. We can identify in all diseases, whatever be the disease. And certain rules are mentioned, certain upadeshas are there, with which we can identify what sort of inflammation or what sort of samprapti has taken place and what all will be its future outcome. All those could be predicted with certain diagnostic principles. Like if it is Ama stage, what will be the next stage? Certain Ama stage will not get transformed to Pakwa stage. So, which cannot be metabolized. Such conditions are also there. So, with principles, we can identify whatever be the cause. And SBB has deciphered the latest diseases like autoimmune conditions, how we have to assess, how we have to interpret, how we have to manage all those conditions are deciphered in SBEBA. Plus, uh, hypothyroidism, it can be by autoimmune mechanism, it can be by other conditions also. So, we need to find out the dosha with its state and stage, then we can find out the mechanism by with the lakshanas, and finally we can exactly diagnose diagnosed with all these factors, Nidana Panchaka as well as Roga Bala and Rogi Bala. As everything is already established, Siddhantas are already established. We need not repeatedly do whether Vata is doing degeneration or Kapha is doing overnourishment. We need not do excess research on that. Already it's established. So we are doing deductive reasoning. Yeah.
Sir, as you told, but nowadays, even the new diseases which is emerging, we are just directly correlating it with the disease which is mentioned in Chikitsa San or somewhere like that. So,
And
like that detail you
correcting
have
medicines from that chapter itself.
yeah.
Yes.
So the detail you have told right now, I think no one, like majority of the people are not doing like this, doing research like this, and I think which is the crucial thing and crucial need of time we have to change all of this in order to rise, I guess, as a bishop.
If an itching is seen, or if it is seen in uh, some localized area, it will be diagnosed as Kandu. One disease will be diagnosed. It can be by excess oil. It can be by decreased oil. By dryness also it can happen. It can happen by allergy. So it can happen even by obstructive jaundice. So
Right.
without considering any of these things, if you directly give something, an oil for Kandu or some medicine for Kandu, which is mentioned in that context, it's not going to do anything, and more harm can develop also. So that is what is happening nowadays.
And even funny correlations are happening. I have seen a physician named COVID Jwara, and he made an interesting shloka on COVID Jwara Nidana Samprapti. It's like mocking the science. The science is giving clear-cut explanations for infective fevers, how to understand. Still, he has made, with his Sanskrit knowledge, he has made COVID Jwara with Krimi, COVID Krimi causing Jwara. So it looks like people are,
Vada Kapha Pradhana Paitika Jwara. What does that mean?
yeah, Vada Kapha Pradhana Sannivada Jwara. That was another diagnosis for COVID. Such things are very misleading. It is distorting the entire science. It is like very unfortunate such things are happening. It is all because of defective education. Again, we reach the same point. Faulty education is the cause of all this.
Some audience has asked questions, so if your answer has not been explained in this session, please personally message me so that we can take the all of your question in the next session, because we are we are already running out of time. So so right now, sir, we have also many questions right now from Roga Nidana. So we will cover up all that question in next episode 5. And all the audience who have the question, please personally message your question if it is not answered in this episode. So from right now, we are signing off. And thank you so much, ma'am and sir, for your valuable input to this episode.
Thank
It
you.
was very enlightening. Thank you,
Thank you,
sir.
sir and ma'am.
And you were also doing very good job. So
Thank you, sir.
this all are to be exposed for the science, and you are doing very good job.
Thank you, sir.
There is one reference. Nachaiva hyasti sudaram ayurvedasya param. There is no end to the ocean of knowledge of Ayurveda. Tasmad apramattaha shashwat abhiyogam asmin gachet. Charaka told, Tasmad apramattaha, without becoming
We
lazy.
tried.
Always stay in contact with the science. Abhiyogam asmin gachet, throughout the life, by proper learning, understanding, and translating. Practice, putting into practice. This is what Charaka says, and you are implementing it by this kind of discussions, initiating the thought process of students and faculties as well. Congrats to you.
Thank you, ma'am.
Great job.
That was so much humble.
Yeah.
Blessed. Thank you, sir. So,
See you.
yeah. So we are signing off. We'll meet in next episode.